The health department reports 55 new HIV cases daily in the Philippines, with a growing number among the youth, some as young as 15 years old. DOH Secretary Ted Herbosa highlighted the urgency of the situation and mentioned exploring the expansion of access to antiretroviral treatment or ARV through the private sector. Mobile Journal, Julie Baiza has the report.
55 new cases of human immunodeficiency virus or HIV are recorded in the Philippines every day according to the Department of Health. These cases commonly involve the youth as young as 15 years old.
Testing natin 61%. We have about 59,000 people living with HIV. It's something like I think 130,000 ang estimate na existing. That's still low for a country with 110 million. Pero ang ating mataas ay yung new cases. 55 new cases a day. Highest in the world. That's why we need to stop. And I think it's because of the education kasi mga bata sila.
Herbosa emphasized the need to educate the youth about safe sex and promote HIV awareness as they have become more experimental and exposed to the internet. They are now coordinating with the Department of Education about the issue. Aside from this, the health department is also looking into the possibility of making the ARV drugs or antiretroviral therapy available in the private sector.
Ang ARV natin sa gobyerno lang makukuha through PhilHealth. You can't buy it on the private sector. The other thing is probably make it available in the private sector. Kagaya TB. Pag walang gamot sa TB.center, ay pumunta ka sa butika, may reseta ka, bilhin mo yan.
Meanwhile, the DOH would not recommend travel restrictions on any country with increasing COVID infections driven by the new coronavirus variant.
I'm not thinking border control, mandatory mask. I'm not thinking that. But I'm advising every Filipino, since that's happening, that can come here, yung minimum public health standards. If you are sick, you have cough, colds, sore throat, it's better to stay home. If you need to go out, wear a mask. So it's still personal.
When asked if this variant have reached the country,
it's possible, although the variant isn't serious. That's why it's only classified as a variant under monitoring. Di ba, may variant of concern, and then yung talagang dinideclare nilang public health emergency of international. So it's under a variant of monitoring. Mabilis siya kumalat, so they're thinking nagwe-wane siguro ang immunity.
Herbosa said that they are continuously monitoring the cases and the behavior of this new flirt variant. Mobile journalist Julie Baiza, We Are One News.